Hi guys, in this video we're going to talk about the effects of high blood sugar on your arteries and your vascular system, okay? Did you realize that 70% of all deaths from diabetes involve the vascular system? So that's why I'm doing this video, because 70% of all deaths from diabetes, that's a huge bunch of people. So why not talk about this specific thing? Now, there's a couple things that happen in relationship to high sugar and what it does to the arteries. Number one, it makes the capillary walls thicker, okay? It makes the walls of the blood vessels thicker. And the name for that is called arteriosclerosis, which is hardening of the arteries and where the arteries become very stiff. So you're also going to see high blood pressure because there's no elasticity anymore, and you're going to see edema in the ankles and the feet. So if you were to press on the foot, it leaves a dent. It's called pitting edema because of the loss of this capillary function. All right, number two, you're also going to have plaquing. And plaquing is the end result of damage within the arteries, where the body starts accumulating cholesterol deposits, protein, and calcium as a band-aid to heal the area. But it forms a plaque, and that is called atherosclerosis, okay, which blocks the coronary artery of the heart, and it's going to cause chest pain. It's called angina, and diabetics are 4 times more likely to develop this simply because high blood sugars, and that's what a diabetic is. They have high blood sugars. That's why they have to take medication. What's interesting to me is that if you look up atherosclerosis, they would say the cause is unknown. They don't know what the cause is, okay? But there's risk factors of diabetes and obesity and smoking and things like that. Well, I'm going to show you my favorite book here called SIBA, Encyclopedia of Endocrinology, Volume 4, and on page 164, they have different pages that describe different aspects of insulin. And the one I want to talk about is called diabetic microangiopathy. Okay, so let's see what Frank Nitter says about this. High blood glucose causes a thickening of the basement membrane of the capillaries of the arteries. So it basically makes the arteries and capillaries thicker, okay? So we do know now the relationship here. In fact, diabetics are 3 times more likely to have thicker arteries. It goes on to say that it dumps protein into the arteries, vascular changes of the retina, that's the eye, an accumulation of protein in the walls of the small blood vessels. It affects the microcirculation of many organs. Yeah, so right here, it talks about the accumulation of plaquing and also the thickening of the walls. So high blood sugar is the cause because there's a dysfunction with insulin. So the best thing to do is, if you're a diabetic, make sure that you do everything you can to bring these sugars down naturally and improve the underlying cause of this, which is high levels of insulin that then lose their function and then can't control it anymore, okay? I put a link down below of some great information on what to eat to support healthy blood sugars. Check it out. Hey, if you're interested in finding out the underlying cause of your body issues, click the link below and take the evaluation quiz.